Hello there, Healthcare Experience Matters listeners. Today, we are joined by Kathleen Lynam. She is an executive coach and senior advisor with the Healthcare Experience Foundation, and she's going to be leading a discussion with Katie Owens, the Healthcare Experience Foundation president. We're talking about relationship rounding as the summer cohort of the Healthcare Experience Foundation's Relationship Rounding Certificate Program is right around the corner, taking place on June 14th. And that program will return in the fall in October. And there'll be more information about that program in the description of today's podcast. So check out the link below to learn more. And I'm going to pass it over to Kathleen, who will take it away for the rest of this discussion.
Good morning. Thank you, Casey. Appreciate that. Well, this is kind of fun. Me getting to do the interview with Katie. I'm thoroughly enjoying this. So what a beautiful morning it is here in New Jersey. So before we begin, Katie, we're going to talk about the certificate program. Why don't you share with our audience about, where we developed the certificate program? There's a lot of them that have been going on, and why it's sort of important at this time in our healthcare world.
Oh, well, absolutely. So, one of our core commitments at Healthcare Experience Foundation is that every person is worthy of an environment where they can both deliver and receive the best healthcare experience. And so, as you know, Kathleen, and you've been an integral part of this body of work, we want to find solutions that meet any leader's capacity to invest in their learning, growth, and development with proven strategies and techniques, because it's so powerful, the individual and team learning experiences that can occur through these programs. And we've seen that whether that's through our equity, inclusion, and belonging, our relationship rounding, physician leadership, compassionate leadership, and health equity in the patient experience. And I think we're going to see that list continue to grow.
Oh, excellent. Yes, it's been very fun. So what about rounding's been around for a long time. I reflected back in grad school in the 80s, MBO, management by MBWO, walking around, observing, management by rounding. What's inspired this certificate, and what's different, this title, relationship rounding? Why don't you share what's different about that and why we're here?
I think every leader in healthcare will attribute their success to rounding in one form or another, whether that's a chief operating officer, CEO, emergency department manager, medical practice manager. Rounding is a fairly universal leadership strategy. And what we've observed in the thousands of hours at the bedside in direct observation of executive and employee rounding is that we've gone a little awry with rounding. And what we've observed and what's been the formative principles around relationship rounding is leaders have moved to the task, and they're rounding, asking questions, yet not doing so in a way that fosters healthy conversation, uncovers barriers, fortifies the relationship between that employee and their leader or organization, or that patient's confidence. And so we have completely retooled our rounding curriculum, our rounding practices, and now even our rounding application with a perspective that rounding should be generating conversations, building relationships, and driving outcomes.
Oh, well said, Katie. And I think about in our work coaching, we've observed hospitals rounding, executives and nurse leaders rounding, and it really has become a compliance and an audit and a checklist. And it kind of breaks your heart to know those opportunities to communicate and build trust and stuff with patients, with staff, has been lost. So I'm very excited about it. Why don't you share with us about the agenda and the learning objectives for this particular course?
I am so excited about the learning experience that we have planned. It's going to be a really immersive half day. We're going to start with the why. We're going to begin with authentic leadership. We're going to skill build on relationship rounding practices and process, really specifically focusing our responsibility as leaders and the opportunity that we have to elevate our rounding with patients, employees, and physicians. We're going to move then into really exploring a leader's role as coach. So many times, Kathleen, and we have lived this in our role as coaches, a leader conducts the round and then the activity largely stops. We're going to really upskill leaders around giving feedback, developing staff, physicians, and providers based on what they're learning with rounding, and making sure that we prioritize recognition. We're going to also explore how to successfully navigate known service recovery and conflicts that will emerge based on a more conversational rounding strategy where we move beyond the surface level of the checklists. And then we're going to have an applied practice session. Every single participant will be building their action plan as they go throughout the day so that we really support our participants moving from learning to application. And I just cannot wait.
Excellent. Yeah, that action planning is probably one of the most pivotal things because, you're taking the time to learn. Now, what am I going to do with it is really, really important. You talked about this is relationship rounding, and certainly since, our milestone looking back is the pandemic and what's happened since then. We had the Great Resignation, then we had the loud quitting, and then we've had such a turnover. Talk a little bit about, what's the value of strengthening relationships at this point for executives, for managers, for a nurse manager doing rounding on patients or staff? How does that really lead to improved outcomes? Can you share some of that information?
Yeah, absolutely. Just yesterday, I was doing a national webinar on helping health systems prepare for HCAHPS 2.0. And one of the results that we shared is our longitudinal research that patient perceptions of their experience have not reached pre-pandemic levels. So if you look at overall patient responses to the HCAHPS survey, we are still dramatically lower than we were in the quarters prior to the pandemic. We've also seen the most volatility in patient perceptions of their experience over the last 4 years. And so patients are feeling the variability that we've had in our workforce. They've been feeling the decreases in workforce, physician, and employee engagement. And so we have to really be mindful that the playbook of 5 years ago doesn't work the same way today. And we have to be adaptable as leaders, or we're going to continue to miss important opportunities to connect, support, and nurture our workforce, and to ensure our patients have the comfort and confidence that they're receiving the best possible care and in an environment that is safe.
Right. Excellent. Good point. I know we participated a while ago in an emerging leader certificate, and we talked about the value of relationships, as a team, how important it is because we're working with different people each day with our leaders, and everything that we've read out there is about, it's so critical to strengthen those relationships here. Can you give us a little tweak into, what do we teach and what do we share that might be different in an initial encounter with, say, a patient or when you're rounding on a staff member? Is there anything unique about ours that you'd like to give our audience a little look into?
Little preview of a perfect example hit me on site just last week. Many times organizations are really working to improve physician engagement, physician retention, physician involvement in quality safety experience initiatives. And this organization has been really struggling to regain physician engagement performance. And, one of the questions I ask is, tell me about your rounding on physicians. And this leadership team said, we round on our physicians. Super. What does that look like? Well, we have lunch in the medical staff lounge, or, a physician or surgeon knows anytime they walk by me, they can tell me what they need. And so when you ask the physicians, how often do you get dedicated time with a member of leadership? They're like hardly ever. And so we've got this disparity between our intent and our perceptions. And if you have a surgeon who's just left a case and maybe there was a frustration over sterile processing or case start time or anesthesia coverage, and you're walking by the chief medical officer, HR officer, you're typically going to hear the frustration. And so what we're helping retool executive teams with are strategies to use empathetic based questions that build the relationship, that focus on the positive, that solicit constructive feedback from physicians in a way that shows we are responsive to your concerns and complaints. We're involving you in the strategic and operational decisions of this organization. We're not just here for the drive-by frustration. We really want to enlist you in how we move the organization forward to make sure we provide the best and safest care for our patients.
Right, which builds loyalty and somebody feels like somebody cares about me. That's so important.
You bet.
One final thing, thinking about nurse managers, directors who may have 100 employees in their scope, or 60 to 90, whatever, large amount. They'll say, I round on my employees. What have we seen impact for our relationship rounding and employee engagement? Any correlation that you can share again with everyone why this is so important?
You bet. So when a leader says, I round on my employees all the time, we always know that's true. We always know that leaders strive to be visible, to be accessible, and sometimes, candidly, for those clinician leaders listening, you do so all hours of the day, night, and weekend because you love and care for your teams. The nuance here is dedicated time asking purposeful questions to involve employees around the outcomes you are trying to achieve. And whether that's how do we retain more of our first year employees? How do we retain our travelers or our agency team members that we really want to bring into the organization? What do we care about with providing our patients with an excellent experience? Who do you want to recognize? I think it's moving from the process of I'm here, what do you need, to an intentional conversation with disciplined follow-up and habits and alignment between executive and employee rounding to demonstrate leadership teamwork. So that's instilling where we see the greatest amount of improvements, where employees feel a stronger sense of trust in leadership, and they report greater degrees of engagement and likelihood to stay in their organization.
That was so interesting, Katie. So such important information for managers and leaders to understand. So as we wind this up, is there anything valuable that you'd like to share with the audience before we wrap up?
I would say for those thinking about enrolling in this program, our first and foremost objective is that you walk away feeling that your effort is equating to outcomes. We know leaders are working tirelessly to advance workforce engagement, retention, and to make sure that patients have safe and successful outcomes, all while delivering an excellent experience. The gap is typically how rounding is conducted. And we are just so excited to share these breakthrough strategies, the promising results, and that every single one of our participants who are trusting their time with us feel equipped to tackle this next generation of what leadership is requiring for healthcare.
Perfect ending. And by the way, I think there are our most highest rated evals come from our certificate programs, right? Along the way that I've seen them, we've got excellent evaluations. So definitely come join us. Thank you so much. And I think I'll turn it back to our coordinator, Casey Callanan, to wind us out and bring us down.
All right. Thank you so much. Kathleen Lynam and Katie Owens have been discussing relationship rounding today on Healthcare Experience Matters. And of course, for more information on that certificate program, go ahead and check out the description of today's podcast below. Thank you both for your time today.